All right. So before entering the patient's room, I'm going to want to perform hand hygiene, check the medical chart, and put on PPE if needed. Then I could go ahead and enter the room and provide for privacy. And then I'm going to turn it towards my patient. I would also go ahead and introduce myself. So I'm going to kneel down so I can be the camera. My name is Nina. I'm going to be your nurse today. I would get 2 identifiers from her. I could ask her name, first and last name, and her date of birth. And then I could go ahead and start asking her questions. Have you had any surgery or trauma to your stomach?
No.
No. Do you have any abdominal pain, tenderness?
No.
No. Any constipation, diarrhea?
No.
No. Okay. So then I would also explain we're going to be doing the abdominal assessment today. I would have her lift her shirt, but we already got that. And we would start with inspection. So I'm going to go ahead and inspect her stomach for any lesions or scars. I don't see any scars, which she hasn't had any trauma or surgery, so that would be a normal finding for her. So no scars, no lesions. I do see a little bit of striae from, have you had children?
Oh, yeah.
Yeah. So she's had children, so that's not abnormal. That's normal for her. I'm also going to inspect the contour of her stomach. I would probably say it's rounded or slightly rounded. I would also check to see if I see any pulsations, primarily up here, which I don't see any. I see the breathing, which is normal. That's a normal finding. It's not excessive. I'm checking her face to see if she's possibly hiding any pain, which she looks relaxed, which is good. We're inspecting to see if we would take a light and inspect to see if there was any lumps anywhere. Or you could also look to the side, and I can see there's no abnormal lumps or bumps, so that's good. We're also going to note the umbilicus. It should be midline. Hers is midline. It's also inverted, which we'd like for it to be inverted and midline. I don't see any inflammation, discoloration anywhere on the stomach, and especially around the belly button, or the umbilicus, I guess I should call it. And no signs of umbilicus hernia. That's also a good sign. So, and the skin, the pigment of the skin looks even, like the pink undertone, so looks like a nice normal pink undertone. It's not pale. She doesn't show any signs of jaundice, which is good. So then we could go ahead, because we switch our assessment around, we're going to go ahead and auscultate next. And we do that because the palpation and percussion can cause sound movement in the stomach. And we will auscultate her bowel sounds. And we would want it on the bell side because what we expect to find is a high-pitched, more gurgly, cascading sound inside the stomach. And we always start in the right lower quadrant, and we work our way around. So I'm going to make sure this is on the bell side, and it is. We could warm it up for our patient. Now, and we're going to listen. Alright, so in the right lower and left lower is where I heard the most high-pitched, gurgling, cascading sound. And then I also listened to the right upper and the left upper. So everything sounded normal. I didn't hear any hyperactive or hypoactive sounds. there definitely was no absence of sounds, which in that case we would want to listen for a full 5 minutes to be sure that is actually what we heard. So we've gone ahead, we've auscultated, and we can go on and move to percussion. And again, I'm going to start in the right lower quadrant and work in a clockwise. We use percussion mostly for finding the liver and spleen to find out the borders of it. And we also use it to find where everything is inside the abdomen. So we're going to start down here in the right lower. And as I percussed, I didn't hear any resonance over the spots where I would expect to find organs. Over the liver, I heard a dull sound as over the spleen. I just hear a little more resonance down here, which isn't abnormal. So her percussions, everything sound normal. We could also use this to find out where that dullness ends, to find where exactly the liver is going to end at. So we've gone ahead and palpated. I heard everything sound normal with a dullness over the organs and more of a resonant sound lower in the stomach. I'm also going to want to auscultate. I forgot one thing when I was auscultating, but I'm going to want to auscultate her arteries. So we would start with down here, which since we're not listening to bowel sounds, I guess the percussions won't be such a big problem. I already did that. But we would do the femoral down here. I'm not gonna make her, but the femoral would be down towards her, down here, where we would listen for any bruits. We would find the femoral artery, and then we'd do it again on this side. Then we would come up to the iliac. And then we would come up to the renal arteries. And then up to the aortic artery. And with auscultating all of those, I did not hear any bruits. So that means there's no signs of stenosis in any of those arteries. It's a good sign. Then we can go on to going back to palpating. Again, we would start with a light palpation, and then move from a light palpation into a deeper palpation, which we would use to find organs. The light palpation is going to be for finding any lumps or lesions. So we could start with our 4 fingers, and we're going to go move around the stomach with our light palpation. And if our patient's ticklish, she will want to let us know. But I guess she's not. And we're feeling around. And with the light palpation, I felt no lesions, no bumps, which is a good sign. And then we're going to want to go ahead and go deeper up towards the liver and the splenic areas. And we would also want to find the kidneys. We could start with the kidneys by going to the upper back, underneath the 11th or the 12th rib, right around there. We would do the duckbill. It shouldn't be palpable, or if it is, it should be non-tender. Any tender spots? No. So the kidney would be in this area, and if it were inflamed or enlarged, we could actually feel it. And then we go ahead and move on to our liver, which is right below. And again, we're going to want to put our arm. It's on the right upper quadrant, and it should be right below the rib, right underneath the diaphragm. Again, it should not be palpable. If it is, it should only be, go ahead and breathe in for me. In and out. So that would be where the liver is at. I don't feel it, so it's a good sign, no enlargement in the liver. And then over here, my knees, ow. So then we're going to come over here and do the same with our arm. We take our left arm, put it underneath the back, and we feel for the spleen. Again, the spleen should not be palpable, or it should be non-tender. Any tender spots?
Nope.
Nope. And then we could go in here and that tickle.
Mm-hmm.
Yeah. So we palpated that. I didn't feel any lumps. I palpated for the spleen and the spleen and the liver and the kidneys. And I believe that is it. I would go ahead and perform hand hygiene and help the patient. And that's it. Yeah.